Hello, folks. This section is going to be the cardiovascular section, probably the most important section that you need to know as paramedics, I would say, because there are a lot of cardiovascular conditions, and your decision-making process out in the field based on history and physical exam and is going to dictate your interventions, which can be very different depending on what is going on with the patient. So very important that you learn as much of this as you possibly can and then build on it in the future. To start off with, in the old textbooks, I know it's chapter 9 in your books. It's called hematology. You might want to turn over to that for just a few minutes, and we'll talk about blood. Blood is 55% plasma. And most of this, actually 92% of the total volume of plasma is water, which amounts to 2.7 to 3 liters, or 2.8 to 3.2 quarts. It also contains proteins in the bloodstream. The main protein in blood is albumin. You need to know that. Glucose is also found in the bloodstream. We've talked a lot about glucose already. There's also mineral ions like sodium, potassium, calcium, and so on. Hormones such as insulin are circulating there. Carbon dioxide and oxygen are circulating in the bloodstream, and we've discussed that. Blood cells, formed elements, if you will, are the blood cells. And antibodies, which fight infection and recognize foreign bodies in the bloodstream, and other microbe attacking cells are found there. Now, albumin is the main regulator of osmotic pressure in the blood. And if you remember what osmotic pressure is, it's the pulling pressure, okay? So when albumin is present inside a blood vessel, it pulls more fluid into that blood vessel from outside the blood vessel in the interstitial areas into the intravascular areas, if you will. Also, plasma circulates amino acids, triglycerides, waste products, fatty acids, lactic acid, uric acid is all found in the bloodstream, being circulated to areas where it can be dumped off and eliminated from the body, primarily the liver and the kidneys when we're talking about waste products other than carbon dioxide. Globulins are also proteins found in the bloodstream. These are heavier than albumin, and there's a couple of types of globulins. The first type are the alpha globulins. They protect the tissues from enzymes of inflammatory cells. And a specific type, the alpha-1 antitrypsin deficiency, leads to a breakdown of elastin, which keeps the lungs, which gives the lungs their elastic property. So if a patient has an alpha-1 antitrypsin deficiency, they have a decreased ability to breathe because their lungs are not elastic as they should be. The beta globulins are a second type of globulin. It degrades protein fibrin clots, so it helps destroy that clot or scab once the tissue is fully repaired underneath it. It controls also the level of free iron and as transferrin, and engulfs pathogens by phagocytosis as piperidine. So there's several different types of beta globulins. Plasmin, which is the one that destroys the fibrin clot. Transferrin, which is the controller of the amount of iron floating freely in your bloodstream. And finally, piperidine, which is the one that engulfs pathogens by phagocytosis. Another type of globulin that you need to know about is gamma globulins, probably the most famous ones of all, because these are most significant for antibody formation. When a patient has an exposure to a stray dog, for example, that bites the patient and then takes off, we have to initiate rabies prophylaxis. Well, at the bite site, we need to inject rabies immune globulin, for example, into and around the bite site to help prevent the onset of rabies in the patient. Blood also carries heat to all body parts. Normal temperature of blood is 100.4 degrees. The liver receives the most blood at any given time. Approximately 1,350 cc's a minute flow through the liver at any given time. The kidneys and the brain receive the next most amount of blood, which is around 1,100 cc's a minute for the kidneys and 700 cc's a minute for the brain. The pH of arterial blood, remember, is 7.35 to 7.45. The blood viscosity is the thickness or a measure of the resistance of blood to flow, which is approximately the measure of the thickness of blood, how sticky it is, if you will. What determines blood viscosity? Well, there's a number of factors. One is the hematocrit. The hematocrit is the volume percent of red blood cells in the bloodstream. It's about 45% for males and 40% for females. Another factor that determines the flow of blood and how fast it goes through blood vessels is the deformability of red blood cells. Remember, capillaries are very tiny, almost microscopic structures that are one cell thick. And these blood vessels that red blood cells travel through take many bends and turns. So red blood cells must be able to change their shape and be able to bend and elongate as they move through these blood vessels. Another one is red blood cell aggregation, which is clumping of red blood cells. If blood cells are clumping, they are forming a clot, right? And that decreases blood flow. Plasma viscosity is the thickness of the plasma. And that has to do with how much water content is in the plasma. The less the water content, the thicker the plasma, right? Blood becomes less viscous the faster it travels. So more viscosity means sluggish movement of blood through the vessels. The color of blood is based on how much oxygen it's carrying. So the brighter red it is, the more oxygen is attached to the hemoglobin molecule. The less oxygen there is, such as venous blood, the darker red it becomes. Next, prothrombin. Prothrombin is also known as cofactor 2, becomes thrombin in the clotting cascade. It's also found circulating in the bloodstream. And in turn is an enzyme that converts soluble fibrinogen to insoluble fibrin, the scab that covers a wound eventually. Fibrinogen, which is factor 1 in the clotting cascade, is a glycoprotein that is soluble in water and is converted to fibrin, which is insoluble by prothrombin. So fibrin clots are insoluble in water. Prothrombin is soluble in water. So until that clot or that scab becomes fibrinized, I should say, it's able to be washed off in the shower. But a scab that forms with fibrin cannot be. There are two types of hemopoietic tissues. The first type is myeloid tissue. It is found in bone marrow, and it produces red blood cells, white blood cells, and platelets in the bone marrow. Stem cells are basic, undifferentiated, immature cells in the bone marrow, and they can differentiate into any type of cell. They are found also circulating in the bloodstream as well as in the bone marrow. And they are found in people of all ages, and they are definitely found in the umbilical cord of newborn infants. So that cord blood is a very valuable substance because it's loaded with stem cells. And when scientists do stem cell research, they are gathering cord blood from all of these delivered babies for their stem cells. A second type of hemopoietic tissue is lymphoid tissue, and it's found in the mucosa of the digestive tract and the respiratory tract, as well as in lymph nodes and lymph tissues, to include the spleen and the thymus gland, as well as your tonsils in the back of your throat. Remember once again that the formed elements are your blood cells. Formed elements include erythrocytes, leukocytes, and thrombocytes. Red blood cell production. Red blood cell production is regulated by a hormone that comes from the kidneys. It's called erythropoietin primarily. It's also secreted from the liver to a lesser extent. The stages of mature red blood cell formation in bone marrow is as follows. First of all, once again, we need a stem cell, that undifferentiated immature cell in the bone marrow. Differentiates and becomes a hemocytoblast. Next, that immature red blood cell, now called an immature red blood cell, forms into a proerythroblast, or also termed a ruberblast, which then evolves into an erythroblast, then an intermediate normoblast, and finally, a late normoblast is expelled or expels its nucleus. I'm sorry, because remember, red blood cells have no nucleus. So at this stage of development, the cell loses its nucleus and becomes a reticulocyte. Reticulocytes are now immature red blood cells that can circulate into the bloodstream and are released from the bone marrow, circulate into the bloodstream, and become mature red blood cells. 1% of the circulating red blood cells in your blood at any given point in time are reticulocytes. After 1 to 2 days, they mature into red blood cells, fully functioning red blood cells. There is a necessary vitamin for this process to occur. It's called vitamin B12, also known as cobalamin. Another vitamin is very important as well for red blood cell maturation, and that is folic acid, also known as B9. These two vitamins must be present for mature red blood cells to form. So if you have a vitamin B deficiency, you're going to be anemic because you cannot mature your red blood cells into functioning erythrocytes. They cannot mature from reticulocytes to that stage. In normal adults, the rate of red blood cell production equals the rate of red blood cells dying. And remember, red blood cells live approximately 120 days. In stress situations, erythropoietin manufacturing and release into the bloodstream is the result of a drop in blood pressure or a drop in oxygenation of the blood. Erythropoietin will travel to the bone marrow and stimulate more red blood cell production from stem cells. Anemia is a condition of low red blood cell count or low hemoglobin concentration in the red blood cells present. Polycythemia means an elevated number of red blood cells in the blood. The most common type of polycythemia that we see is chronic smokers. because chronic smokers have a chronically low oxygen level in their bloodstream because they're breathing all this CO2 and carbon monoxide from cigarette smoke, their red blood cell production goes up, so that what oxygen is available is definitely going to be carried through the bloodstream. That predisposes smokers to forming blood clots because they have way too many red blood cells circulating through the bloodstream. A study posted in the Science News Journal in July of 2016 was done at Massachusetts General Hospital, and it showed that the liver, not the spleen as previously thought, is the major site of red blood cell cycling and breakdown after that 120-day period is up. Aged or damaged red blood cells are taken up by monocytes, a type of white blood cell circulating through the bloodstream, which produces, the monocytes produce macrophages in the liver, which engulfs and ingests red blood cells, breaks them down, and the heme part of the red blood cell is broken down into iron molecules and bilirubin. This bilirubin circulates and is bound to albumin in the bloodstream. The iron is released into the plasma and is bound to transferrin, a substance that we mentioned earlier, which is a globulin type of protein. All right, let's go over the ABO and RH factors in our blood. Red blood cells can have sugars exposed on their cell membrane surfaces called agglutinogens, which are antigens. And there are two types, type A or type B for the ABO blood typing system. In plasma, not red blood cells, but in plasma, there are antibodies called agglutinins that may or may not be present. So take a look at an ABO chart in your textbooks and note that type A blood has anti-B antibodies in the plasma. Type B blood has anti-A antibodies, or agglutinins. Type AB blood has no antibodies or agglutinins in the plasma, and type O blood has both anti-A and anti-B agglutinins. On the surface of type A red blood cells are agglutinogens or antigens present, which are type A antigens or agglutinogens. The type B blood cells have type B agglutinogens on their cell membrane surfaces, and type AB blood has both A and B agglutinogens on the surface of their red blood cells. Type O has neither agglutinogens on the surface of their red blood cells. So if you have type A blood, you have A agglutinogens on the surface of your red blood cells, and you have anti-B agglutinins or antibodies in your bloodstream or in your plasma, and vice versa for type B. And for type AB blood, you have both types of antigens on the surface of your red blood cell, but in plasma, you have no antibodies. Otherwise, the plasma would react with your red blood cells. And with type O blood, again, you would have no antigens on the surface of your red blood cells, but you have both type A and B antibodies in your plasma. So when we talk about universal donors being type O blood, that is the packed red blood cells only, because if you donate the entire blood, including the plasma, to, for example, a type A blood type patient, then those anti-A agglutinins in the patient's type O plasma would attack the red blood cells present in that patient's blood. So it's very important that you understand that when we're talking about type O blood being the universal donor, it's the red blood cells only, not the patient's plasma that we're talking about. And the universal recipient being type AB blood, because any type of blood cell can be transfused into that blood type patient without causing a reaction. Now, in addition to the ABO system, there's an RH factor system. And the RH antigen is another agglutinogen found on the surface of red blood cells. And if it's present, which most people have on the surface of the red blood cells, your blood type is positive. If you do not have the RH factor on your red blood cells, your blood type is negative. Simple as that. So if you're B positive blood, you have both type B and RH type agglutinogens on the surface of your red blood cells. The only problem with RH factor seems to be, well, not the only, but the main problem with RH factor is when we have a pregnant mom that is RH negative who conceives a baby with an RH positive father, and the baby ends up being RH positive. Well, when the baby's blood, as it will eventually mix with the mother's blood, that RH positive red blood cell getting into the mother's bloodstream will cause RH antibodies to start forming in that mother's plasma to cause a reaction if it's ever exposed to RH positive blood again. So baby number one usually is born without a huge problem if the baby is Rh positive and mom is Rh negative. However, baby number two that is born to that mother, if Rh positive, is if and when the blood is mixed with the mother's blood, then there's going to be what we call a hemolytic reaction, where the mother's plasma agglutinins that are anti-RH will attack those RH agglutinogens on the surface of the baby's red blood cells and cause the blood to hemolyze, which means totally break apart. The red blood cells are all destroyed. Well, that's going to lead to the demise of the child very quickly. So to prevent that, Rh negative moms are given a RhoGAM shot at about 28 weeks gestation, and this prevents the mother's plasma from forming Rh antibodies or agglutinins, so that there's no reaction that can take place. So that's red blood cells. Next, we need to talk about white blood cells. And the different types of white blood cells are pictured here in your textbooks in Chapter 9. There are several different types. And if you don't like the picture in Chapter 9, just go to Wikipedia and type in leukocytes or white blood cells and pull up a picture of all the different types of white blood cells. Leukocytes are white blood cells produced again in bone marrow, and they also come from stem cells, those immature, undifferentiated cells. White blood cells have nuclei. Remember, red blood cells do not. The normal white blood cell count, depending on which lab and depending on which textbook you read, is about 4,000 to 10,000 cells per microliter of blood. 1% of your total blood volume is white blood cells. Leukopenia means a decreased white blood cell count, and leukocytosis means an increased white blood cell count. Now let's take a look at the two major types of white blood cells, the first of which is called the granulocytes. There are 3 white blood cells that are granulocytes. They are neutrophils, eosinophils, and basophils. Let's take a look at the neutrophils first. They are the most abundant white blood cell in the bloodstream. 60 to 70% of all white blood cells are neutrophils. They are also called PMN cells, or polymorphonuclear cells. They have many nuclei. They kill pathogens by phagocytosis, engulfing and ingesting these foreign substances that enter the bloodstream in the body. And they are very effective against bacterial infections and fungal infections. The lifespan of a typical neutrophil is about 5.5 days. Next one is eosinophils, which make up about 2 to 4% of all the white blood cells that we have. They are the main inflammatory cells in allergic reactions and secrete chemicals to destroy parasites. So we will see an elevated eosinophil count in a parasitic infection or an allergic reaction in a patient. They're primarily found lining the respiratory tract. Basophils is the third type. These are the rarest. 0.5% of all white blood cells are basophils. They're responsible for allergic reactions, and they secrete histamines. Make sure you star that and know that. Basophils secrete histamines. Histamines, in turn, cause vasodilation. So if someone has a widespread, serious allergic reaction going on, and they're vasodilating, what would you expect their blood pressure to be? Increased or decreased? Decreased, right? So these patients are hypotensive when they're suffering from a serious allergic reaction. The other substance that basophils are capable of secreting is heparin. And I'm sure you've heard of heparin. It's a blood thinner, and it anticoagulates. It promotes movement of white blood cells to areas of inflammation and infection. Okay? The second type of white blood cells are agranulocytes. The first of which is lymphocytes. Lymphocytes are the main fighter of viral infections. They're mainly found in lymph vessels and in lymph tissue. There are several different types of lymphocytes or subcategories. The first of which you need to know are called the B cells. B cells make antibodies to fight pathogens. The second type is called T cells. And in the category of T cells, there's many different types. There's helper T cells, killer T cells, delayed hypersensitivity T cells. There's a bunch of different kinds. The ones that I want you to know about are the helper CD4 cells. Helper CD4 cells are a type of T cell that makes cytokines, which are small proteins that signal an area of inflammation or damage in the body. So basically, those helper CD4 T cells call other cells to help fight an infection or an inflammatory situation going on in a body area. The next type of T cell is CD8 T cells. These bind antigens of viruses, as well as tumors, and kill them directly. Natural killer T cells is another type. And again, by their name, they kill by direct action body cells infected by viruses or tumors. So they fight not only viruses, but also cancer cells. The second type of agranulocyte, leukocyte, is the monocyte. Monocytes are phagocytic, so they destroy pathogens in the bloodstream and in the body by engulfing that pathogen and then digesting it by breaking open their lysosomal sacs. They're also present in pieces of pathogens to haul to T cells, which are the lymphocytes, so that these can be recognized again in the future and destroyed. So this is one way in which you get your immunity. So for example, if you're exposed to the chickenpox virus, Typically, we don't get the chickenpox virus again and again, even if we're exposed to it in the future, because these monocytes, once they phagocytose that virus, they actually carry through your bloodstream little pieces of the virus and haul it to the T cells to make memory, so that if you're ever exposed to the chickenpox virus again, those T cells will remember, oh, we've seen this virus before, and respond to it immediately and destroy it before it ever gets a chance to make you sick. Monocytes are capable of leaving the bloodstream and becoming macrophages, which are capable of phagocytosis and also producing cytokines like the basophils do. 2 to 10% of all your white blood cells are monocytes, and half of all the monocytes that we have at any given point in time are stored in the spleen. So if you lose your spleen, you lose a good number of your monocytes at any given moment in time, which affects your immune system. Platelets are called thrombocytes, the next type of formed element cell. They are like red blood cells in that they have no nucleus, and they are about 20% the size of a red blood cell, so they're extremely small. They are activated when endothelial lining of blood vessels is disrupted. Platelets will first attach to the edge of the damaged portion and adhere to one another, start forming a little bridge, if you will. Next, aggregation occurs, whereby the platelets will attach to each other and build an entire plug across the whole of that disruption. This is what we call the platelet plug. They change shape during this process, the platelets do, and turn on receptors to launch an inflammatory response. The coagulation cascade next occurs to ultimately produce a fibrin clot. Remember that fibrin clot is necessary because it's an insoluble scab that cannot be destroyed by water. Intact blood vessels prevent blood clotting by secreting heparin in their lining, inside the lining of the blood vessels. They oppose platelet aggregation, and for good reason, because we can't be walking around with blood clots all day long. And another substance is also present, nitric oxide, and a third substance, prostacyclin. All three of these substances, heparin-like substances, nitric oxide, and prostacyclin, all prevent platelets from activating until there is an area of disruption in a blood vessel. When an injury occurs, these substances are no longer secreted, and a factor called a von Willebrand factor is instead released. This factor initiates the platelet aggregation and the platelet plug formation to begin, and is part of the coagulation cascade. Now you can look up the coagulation cascade on the internet, on Wikipedia, or wherever, and you can see that it is a big, long process. And there are actually two arms to that coagulation cascade, an intrinsic factor and an extrinsic factor. And von Willebrand's factor is very important in initiating this coagulation cascade. So if you are born without this factor, what happens to you? You don't have platelet aggregation, so therefore you continue to bleed from the disruption in the blood vessel, no matter how large or small it is. And that's called hemophilia. The first step in stopping hemorrhage is vasoconstriction. So as soon as a blood vessel is damaged, it vasoconstricts or spasms shut as much as it can. This is initiated by pain receptors, because when a blood vessel is cut or disrupted, it causes pain, right? And so the sympathetic nervous system responds to a painful stimulus by secreting epinephrine at its nerve endings to cause vasoconstriction. And the receptors that are activated in those blood vessels, remember, are called the alpha-1 receptors. The second step is the action of platelets that I just mentioned, causing the platelet plug formation. And the third and final step is the fibrin clot. I mentioned before that the coagulation cascade has two arms, the intrinsic and the extrinsic pathway. The extrinsic pathway is the body's preferred pathway to take to cause the fibrin clot to form. Vitamin K is very vital to factors 2, 7, 9, and 10 working correctly. So if you lack vitamin K, you're going to continue to bleed, okay? So if a patient is on Coumadin, also known as warfarin, that substance opposes vitamin K. So factors 2, 7, 9, and 10 go, are in the presence of Coumadin, are not able to work or initiate because of the opposition of vitamin K. So you continue to bleed. It's a blood thinner to prevent platelet aggregation and blood clots to form in patients who are predisposed to forming them. The downside of that is if the patient is in a car accident and has a fall or any type of trauma, they can bleed to death very rapidly, and it's very difficult to stop the bleeding process in those patients. How do we stop it? Well, ultimately, we need to give them vitamin K to reverse the Coumadin, right? And then replace the blood volume that they've lost. Factor 9 is called the Christmas factor in the coagulation cascade. Next, I want to give you just basic normals of a complete blood count. A complete blood count is normal levels of all these blood cells that we just mentioned. Normal white blood cell count is around 4,000 to 10,000, as we mentioned. Normal red blood cell count in males is 4.5 to 5.5, and females is 4 to 5. Normal hemoglobin in males is 14 to 16 grams. In females, it's 12 to 14 grams. A normal hematocrit in males is 42 to 52, and in females, 36 to 48. And finally, the normal platelet range is a big range. It's 140 to 400,000. 140,000 to 400,000, I should say.